So today we're going to be talking about some of the bed draping procedures. So as I have her right now, I have her covered fully at the chest and the lower legs, but her lower legs are exposed, and that's good for any general medical diagnosis as well as just a regular lower extremity orthopedic surgery, like lower extremity range of motion. If I were to set her up for an acute ankle sprain, we're going to make sure that her ankle is elevated above her heart. So that's why we're going to have 3 pillows. These are thick pillows, so you can relax if you would like. Thank you. Making sure that her ankle comes off so we can do any type of treatment that we need to do. Okay. And then next, if we want to prepare for lumbar spinal fusion surgery patient, and they're going to be doing lower extremity ankle pumps and quad sets, glute sets on one side. Let's say we're going to do it on her left leg. We'll just have one pillow, and I'm going to put it a little bit up under her knee, just to make sure we keep her in that posterior tilt. Good. Are you comfortable? Okay. And then next we can set her up as if she was a stroke patient. And we'll just remove this. And then make sure her affected side, her arm. We discussed this in class. If we're about to do anything with the stroke patient, the affected side, we can have it up on the chest just so we remain aware of what side it is that is affected. And then we will prepare for the chronic frozen shoulder patient next, and then we're going to get ready to do some treatment. So I'm going to have you roll towards the wall there, okay? I'm going to try to keep her covered through the whole process. And if she had a gown on, which ideally she would, we would have her gown come off, and she could stay under the sheet the whole time so she can be properly covered. And then we would have the sheet just above her chest, but we would have this, you can relax this one, we would have her shoulder exposed here. And I'm going to make sure that I put a pillow underneath this leg for comfort. Okay, and then also we can put a pillow underneath this arm for comfort as well. Are you comfortable like that?
Mm-hmm.
Yeah? Okay. And then next, for a herniated disc patient, we're going to prepare for laser treatment, ultrasound, TENS, pretty much anything that we need to do on the back. And so she is already laying down in a pretty good position for this. The only difference is, once again, she'll have her gown pulled off. And then her spine is not really in neutral right now because she has such a high pillow. So is it okay if I take this pillow, and we're going to make sure your head is in neutral. And then we're going to slide her gown off, or if she's wearing a shirt, we can just pull the shirt up and placing a towel underneath. And make sure we can tuck the sheet at the bottom just into her shorts. And so then there is the open back for whatever treatment. And this is better for people who are pregnant or have any issues laying supine. And we could do it sitting and over a bench, but we also talked about in class how that can maybe tense up some of the muscles there, put it more on the stretch, making it a little harder to do the manual therapy that once that needs to be done, or any other procedure. It might be a little more difficult. So that is a couple of the positions that we would do for draping, making sure that the patient is covered properly while able to be given access to the body parts that need to be worked on.